Best Doctors 2010 edition, St. Louis. Jared, thank you so much, and again, congratulations on your new position as Editor-in-Chief. The Best Doctors issue, again, on newsstands now. Let's send it over to Carol and one of Great Day's top docs.
She sure is. This is Dr. Teresa Knight, CEO of Women's Health Specialists of St. Louis, and you just returned from this amazing trip to Africa. Her jewelry is from the women of Masai. It's good to see you again. Welcome back.
Thank you. It's so great to be back.
You were in Africa for 2 weeks. Why did you go?
So I went, well, first I should say who I went with. I went with Ann Wells and Unite the World with Africa. And without her, she's the director and founder of Unite the World with Africa. Without her, we would not have had the contacts or the vision to be able to do what we did.
And the organization it took, because it took a year of planning for this trip.
Exactly. So she had been to Tanzania multiple times, and she had contacts with local physicians in Tanzania as well as women's groups. And so when we were able to descend upon Tanzania, we had those contacts there, and we were able to make just an amazing amount of progress in developing a women's education program.
We have a sense in the U.S. of what healthcare is like in third world countries, is what it is like in much of Africa. Our assumption is that it is pretty bad.
That's a good assumption. I went in part because I couldn't believe that it really was that bad. We have, for every 3 women, we have a doctor here in the United States.
For every 3 women, there's 1 doctor in the U.S.
Yes.
Okay.
In Tanzania, for every 40,000 women, there is 1 doctor.
Every 40,000 women.
That is correct. And the reason for that is because who's going to pay for them? Who has the money to pay for someone to become educated as a physician? Who's going to pay for those services? Who's going to pay for the technology?
And those who become physicians usually go to other countries.
Absolutely.
They don't stay.
You're going to go where you can get a job.
And you've related healthcare, health, wellness to economic stability, to reducing wars.
Absolutely, and this is something called the girl effect. So the girl effect is if you go to a village and you educate the women of that village, you don't just improve the girl's ability to succeed, you improve the whole village's ability to succeed. And it makes sense. These are the women who are going to be the caregivers for a family. They're going to have provide a stable home for children. And we all know that if children have a stable home and they have the ability to obtain an education, they're going to succeed. So that's what the goal of this program was to develop not a mission trip where we go in there, we work, and we leave, but to go in there and to establish medical training for the women who are living in the villages that are already the established leaders of their village or are already the healthcare providers of their village. We're going to give them new tools to be able to provide better healthcare for the women in the village. And those women are staying there. They're not going to leave.
And what's amazing to me, Dr. Knight, is that you found that women like that have the same healthcare issues that we have. Some of the same healthcare concerns and questions that we have.
Absolutely. You know, we are really not different. We come from different circumstances, but our common needs and wants and desires are the same, and our physiology and our anatomy is the same. And so the women who have managed to live beyond the tuberculosis and the malaria
and childbirth,
these women now are experiencing, adorable, are now experiencing menopause. And menopause is such a new concept that they don't even have a word for it.
Are they as angry as I am sometimes?
Oh, gosh, well, they think they have malaria.
Frustrated and
they all think that they have untreatable malaria because they're having hot flashes and night sweats.
It's not malaria, it's menopause.
That's right.
That's an ad campaign for you. It was also interesting to me, Dr. Knight told me that the women were amazed that one of the questions they kept asking you was, what did you build your house out of?
Yes, and I didn't understand at first until I went to their homes and I sat and had tea in their homes. And they live in a home called a boma, and this boma is made of mud and dung. And those women make those houses.
They build it with their own 2 hands.
They build it with their own 2 hands.
And we, of course, do not do that.
No.
And they were amazed that you didn't build your own house.
They were amazed at how little I did do.
And we're amazed at how much we do. So how can we help?
So
we are a generous nation. How can we help?
There are a lot of ways to help, and that's the one thing I learned from Tanzania, that without enormous amount of effort, we can make enormous amount of change.
And so what do? We can go to a website and donate very little and have a big impact, can't we?
Absolutely. $5 buys a mosquito net. So we can go to the website for Great Day St. Louis. We can go to Facebook and we can type in Unite the World with Africa, become a fan, Social shopping, this jewelry, this beautiful jewelry is made by the Masai women. We can sell it here in the United States, and that money goes back to those women. They in turn learn and continue to grow financially and be able to buy more things for themselves and for their children.
We change the women's lives, we change the world.
We really do.
Thank you very much.
Thank you.
And to the women from Masai, these are beautiful.
They are gorgeous. They really look great on you.
And you guys know you love the terminology social shopping. Come on, we know that.
This is the ultimate green. It's the ultimate green.
Absolutely. Again, just go to greatdaystlouis.com and we have a link there for you. Claire, social shopping. That's the next
easy.
best thing. Yes.
Thanks, Carol.